There is an effort in D.C. to expand access to pre- and postnatal care for minorities. Pregnant people in D.C. are already more likely to die in childbirth compared to the national average.
And Fox 5's Katie Barlow has a story in the heart of Ward 7. Katie.
Angie and Rob, the number of people who die during pregnancy or from delivery-related complications here in our nation's capital is already above the national average, and that number increases exponentially when you're just looking at Black people giving birth. According to a recent government-led study here in the district, they make up 90% of birth-related deaths in Washington, D.C. And Mamatoto Village is working in Northeast to change that.
We have yoga, which is lovely.
I really want to do yoga.
Yes, please come.
Yeah.
Princess Harris is due with her first baby in January. Right now, she's trying to find a permanent home and job, all while battling the nausea and exhaustion of growing a human. She turned to Mamatoto Village for help.
I feel like, Princess, you don't have to go through this alone. Not only does your family care about you, but we don't have to be blood in order for us to care and help you out. You know what I mean? I think village is what they bring in this building.
Black people who are pregnant in D.C. are more likely to experience chronic hypertension and preeclampsia. Left untreated, both can cause serious, even fatal complications. Access to health care is also a major hurdle, according to the D.C. Maternal Mortality Review Committee. There are more general hospitals in Northwest D.C. than wards 7 and 8 combined.
I was experiencing a sense of racism in terms of implicit bias and not being respected in what I wanted. I was experiencing kind of being gaslit by providers.
Jasmine is an education specialist at Mamatoto Village and a mother of 4. She came to Mamatoto for help having her second child. She stayed because she saw how much of a difference they make for Black mothers and babies. Black people make up roughly half of all births in D.C., but account for 90% of pregnancy-related deaths. That's compared to white people who are pregnant. They make up about 30% of births in the district, but experience 0 pregnancy-related deaths, according to D.C. Health.
I have the will to fight, and I have the will to want change, want to get where I need to go. So I'm going to be okay.
Even with all the work they're doing in Ward 7, Mamatoto Village is just a small part of tackling this problem. As Princess says, if we're actually going to fix the Black maternal mortality rate in the district, it'll take a village. Back to you.